is so critical in having good health in the long run. I'd like to tell you two stories. My name is Dr. Stanley Lang, and I practice whole person health or holistic health. And the concept of holistic health is that you try to integrate health in all three major spheres of your being, physical, emotional, and spiritual, at the same time. And how to do that, of course, there's going to be a lot of different opinions. I'm sharing some ideas that I have developed over the years as I've watched patients struggle with being well. Now, obviously, I see a subset of people that are having more problems than probably the average person walking around. They're here in the office because they'd like some help getting better. So when a person reaches a point where they're not at their best, what's the best way forward? So the first story I'd like to tell you is a patient who is one of the unfortunate COVID casualties from having to stay at home all the time. And she's in her upper 70s. She's got some of the risk factors that people talk about. And she is one of many patients that I have that are just like her in terms of this dilemma. Now, most of the folks that I have as patients, and I have the privilege of giving advice and care for, have been sort of fallen apart in their disciplines during the last couple of months. And a small percentage, though, have actually been doing very well, and some actually making progress in their disciplines. And this patient that I saw today is a good example of where the spiritual part of health is really critical in moving forward with health in general. So she is not at all weighed down by the fact that she's much more isolated than usual, because she's experiencing so much in her relationship with God. And we had a telemedicine visit today, and so she shared some of the things that she's doing, and it's really clear that this is a person that her faith is a really core part of her life. It's not a sort of a corner part of her life, but it's a core part of her life. So for people who may see this video, if you have a faith life, sometimes we forget to put it front and center. And when we forget to do that, if it's off to the side, stressful circumstances tend to push it even more off to the side. Whereas if we can move it back to front and center, it can help to center us around the healthy disciplines that are part of whole person health. And so that's what she's doing. So she's spending most of her day relatively joyfully doing things that are good for her. And so subsequently, she's actually being more physically active than she had been. And we talked about how she could do a high intensity interval program in her age group, in her apartment, and with no equipment, which is possible to do. And she was quite willing to do that. So I taught her how to do that over the phone, actually over the video. And so this person is using the spiritual resources that she has to integrate the physical health disciplines she needs to do to be completely healthy as a person. And so can you. If you don't have a faith life, that's a place that you can start looking at. And maybe this is an opportunity to grow in developing a faith life. So the second person is on the other end of the age spectrum. She's not in the house all the time because she's not done any of the risk factors, and she has a job that she goes to at least some of the time. And she is doing well also because she is currently in a state like this. In fact, she's doing so well in integrating some of the recent physical disciplines that I've given her to do that she's weaned off of 2 medications that she's been on for a long time. Both of them very potent medicines. And she's just now starting to wean off of a major antidepressant medicine because she's doing so well integrating these lifestyle strategies. And she shared, though, that, we talked a little bit about depression, and she shared some of her struggles with it. And it's clear that that when she's got all three of these spheres going, she does better in resisting the trend towards becoming depressed. But what was missing in her life were a couple more disciplines, physical disciplines, which we talked about. So she's sort of shoring that up. But both of these people, on opposite end of the spectrum, age spectrum, the glue that is holding them together and making them have much better health than the average person that's walking around there right now is their spiritual life. So my encouragement to you is, if you've got any kind of a spiritual life, try to move it front and center. And if you don't have one, try to look around for ways to start to grow that part of your life, because that's, to me, the foundation of good health. And the reason for that is because one of the critical spiritual disciplines is the discipline of forgiveness and dealing daily with the inevitable resentments that come into our lives. And if you don't have a spiritual life, you have no practical way of dealing with resentment. And if you don't deal with resentment, you are carrying around a big weight of chronic stress-inducing emotions, and you will be off center in terms of your health. Your neurological system will be off center. You'll be in sympathetic overdrive, which pushes all of your organs off center, and your chance of being really well is diminished substantially if you don't have a spiritual life that helps you to completely deal with resentment and unforgiveness. So I encourage you to take advantage of all the resources God has given us every day, and to try to grow. How can I do it better today than I did yesterday? So I wish you well, good health. God bless, and have a good day.